Are you leaving money on the table by not using the CPT code 90833 correctly or by missing key documentation that supports it? I've noticed many psychiatric providers either forget to bill for it or fail to document properly, which leads to denied claims and lost revenue. If you're a psychiatric provider doing both medication management and therapy during the same session, you might be leaving money on the table. So we can fix that. Let's fix it. Hi, I'm Dr. Georgette Kui, a psychiatric provider passionate about sharing clinical insights on mental health and helping clinicians get paid for all the work they actually do. In today's video, we are diving into what CPT 90833 code is, when and how to use it, real examples that qualify and don't, common billing mistakes. So let's get into it. So what is the CPT code 90833? It is a psychotherapy add-on code used for psychotherapy lasting between 16 and 37 minutes, provided in conjunction with an evaluation and management service, like maybe medication management or diagnostic evaluation in the same session by the same provider. Think of it as a combo code, meaning medical evaluation plus a structured therapy session like maybe CBT or supportive therapy. So instead of only billing for one part of the visit, this code lets you bill for both. To build the 90833 code, you must provide number one, a medically necessary E&M service like medication management, and number two, psychotherapy lasting at least 16 minutes. For example, a psychotherapeutic intervention, not just supportive advice. The psychotherapy must be active, structured, documented, and not just general conversation. Let's look at examples that qualify. A patient with generalized anxiety disorder comes in feeling more restless. You review their symptoms, assess response to current SSRI, and you increase the dose. You then spend 20 minutes doing CBT focus on avoidance behaviors and cognitive distortions. In this case, you can bill 99213 plus 90833. It qualifies because there was a clear E&M service, which is the med adjustment, and you also spend 20 minutes of structured psychotherapy, which is CBT. Another example is a patient with major depressive disorder reports ongoing grief-related triggers. You evaluate their medication adherence and consider augmentation. You also provided 25 minutes of supportive therapy focused on coping mechanism and affect regulation. You can bill 99214 plus 90833. It qualifies because there was a med review and also 25 minutes of valid psychotherapy. A third example is a patient with PTSD describes nightmares and intrusive thoughts. You assess their current regimen and you discuss starting them on prazosin. You provide 30 minutes of trauma-informed therapy using grounding techniques and exposure therapy. You can bill 99214 plus 90833 because there is a legitimate E&M component, which is the med change, and there's also structured documented psychotherapy session. So examples that do not qualify is, for example, a simple medication refill. Maybe you briefly check in with a stable patient, confirm no side effects, and you refill their medications for ADHD, and you didn't provide any therapy. You cannot bill for this code. You can bill for the main E&M service, which is 99213. It doesn't qualify because no psychotherapy was performed. Another example that doesn't qualify is discussing labs or side effects only. You review lab results like lithium levels and adjust the dose. No therapeutic techniques are used. You cannot bill for this 90833 code. You can bill just the E&M. So it doesn't qualify because medical management alone isn't enough for us to bill for this code. The psychotherapy must be delivered and it must be at least 16 minutes. Or another example is you provide 10 minutes of emotional support and coping skills after a medication check. You cannot bill for this code. You must spend at least 16 minutes in the therapy to bill any psychotherapy add-on code. So who can bill for the 90833 add-on psychotherapy codes? Psychiatrists, MDs, DOs, PMHMPs can bill PCPs trained in behavioral health. You must be licensed to do both the medical and the therapy part. So for example, psychologists or licensed clinical social workers can use this add-on psychotherapy code. They can use a standalone therapy code instead, like the 90832 or the 90837. Documentation tips to avoid denials. To get reimbursed for the 90833 code, your notes must clearly show both, number one, the medical component, like medication management, lab review, symptom evaluation, etc. It also needs to show the psychotherapy component. The time spent must be at least 16 minutes. You also need to include the type of therapy in your notes. Was it CBT, for example, supportive, psychodynamic therapy? You need to include therapeutic focus, the goals, the intervention, and also the patient response. And don't forget the modifier 25. Add to the E&M code to show the medical and therapy service were separate and distinct. For example, you can write 99213-25 plus 90833. Payers will deny or downcode claims if the documentation doesn't clearly reflect both services. Capturing all required details, especially under time and pressure, is tough. That is why we have tools like Companion Medical Scribe AI. It is a game changer. It can help providers automatically capture the therapy and also help with the notes. It can organize the notes to meet payer documentation standard. It can reduce the risk of denials or audits. Remember that better documentation equals better reimbursement and less admin stress. So this tool is a HIPAA-compliant assistant that literally writes your clinical notes in seconds. It can generate detailed clinical notes in seconds. It can draft the HPI, for example, the assessment, the review of systems, the mental status exams. It can suggest diagnosis and treatment plans. It can recommend medication, even the dosages. It can generate letters, referral letters, patient instructions. It can also help with ICD-10 and billing codes. It can also help answer clinical questions with evidence-based sources. And it works with any EHR. You can just copy and paste, and it also works across different medical specialties. It's like having a smart assistant that cuts your charting time in half while helping you also make better decisions. So no more late nights catching up on notes. No more burnout from documentation overload. It is safe, secure, and is currently helping lots of healthcare providers nationwide. And if you're a psychiatric mental health nurse practitioner looking for a comprehensive but focused review course, and if you're preparing for the ANCC or the AMP exams, check Georgia's PMHME certification review courses. It has helped thousands of NPs nationwide succeed on their exams confidently. So just to wrap up the main topic for today, please remember that CPT 90833 lets you bill for both psychotherapy and medication management in one visit, and ensure that your documentation is clear, time, and also includes the modifier 25. And use tools like Companion Medical Scribe AI to streamline your workflow, capture your billing details, and protect your time. And if you found this video helpful, please don't forget to follow me here and also on other social media platforms for more clinical insights and tools that can make your life easier. Thank you so much.